topic that I'm choosing to talk about is substance abuse patients and the nursing attitudes towards those types of patients. So my PICO question is, do patients experiencing substance abuse receive poor nursing care as compared to patients not experiencing substance abuse, and can this result in relapse? So just an introduction, review of the literature, a couple facts. The World Health Organization reported that there were 2 billion alcohol users and 185 million drug users worldwide in the general population. So with that being said, obviously there's a huge problem. There's going to be a lot of patients seen like this, and it is reported often that nurses working with substance abuse patients have negative attitudes towards them. So with that being said, the nurse-patient relationships, they're going to have conflict, aggression, mistrust, and ultimately negative attitudes may result in patient relapse, or just in general them not wanting to seek care at all. So the nursing theorist that I chose to talk about with this is Hildegard Peplau, and because she talks about the nurse-patient relationship, and with a patient like this is the most important thing, to have a good nurse-patient relationship, because if they don't feel comfortable with you or they feel like they're being judged, automatically it's going to be negative right off the bat. So this is her interpersonal theory. The nurse and patient, they might have different values, they might come from a different race, they might have different beliefs, but the thing that faults the nurses the most is the preconceived ideas of these patients and maybe their past experiences. You know, they might think these patients are coming in and just wanting more drugs, or they may have had a negative experience with one of them in the past. You know, they may have family members that have substance abuse problems, and this is their personal bias affecting whatever patient they're caring for. And so the methods I used for this study, it was a mixed methods approach. So there's qualitative and quantitative data. I'm doing in-depth interviewing, so this will, there will be like a semi-structured interview, so there's sort of a guide to the questions, but you know, the patients and the nurses are going to answer however they're comfortable, and basically the floor is theirs. They can share whatever they would like. There's going to be survey questions before and after the implementations I have, and I'm also going to use an alcohol problems perception questionnaire, which will be like a little bit modified, and also a modified version of a disapproval of drug use scale. So down here I have the alcohol problems perception questionnaire, and that's more quantitative. It's using a Likert scale. So, you know, it'll use, you know, do you strongly disagree, you know, are you neutral, or do you strongly agree with whatever these questions are asking. And then we'll see at the end what the score adds up to, and, you know, you'll determine your personal biases maybe, or whatever you need to change. So like I said, there will be a pre-test, post-test survey before and after the implementations. The setting I chose to do this out of was an area that has a higher rate of substance abuse. So with this, to control the study, it's either going to go two ways. So one way being that the nurses see these patients more often, so they may be more likely to be empathetic towards this population, or it could be opposite, and they see them so often, they're irritated with them, they treat them more negatively, they think they're manipulative. And the sample I'm doing, I'm picking nurses from different units of the hospital, so that it's not just people working directly with them, because I want to see what other nurses' opinions are about this population. I'm making sure there's 60 total, 30 nurses, 30 patients. It's big enough to determine an accurate result based off of the interviews. You know, I wanted to avoid bias by not picking just a specific detox floor, so I'm going to be using med-surg floors, emergency departments, and detox floors. And then in general, whenever I'm talking to the patient, whether it's the patients, the nurses, whoever the participants are, they will know that they'll get an in-depth explanation about the study and the purpose and the types of questions they'll be asked. Participants will get an informed consent and they'll have to sign that. They will know that they'll be quoted, but there will be no names, and it will be completely, their identities will be completely anonymous. And then participants will know at any time that if they do not feel comfortable, they don't have to answer a question, or they can back out at any time that they please. So the purpose of this study is to decrease the negative attitude against substance abuse patients, increase empathy towards substance abuse patients, and gain more advocates for substance abuse patients. So the implementations during the study, they'll get an education-focused training, and I'm thinking maybe adding additional supervision with newer nurses and even nurses that have already been on the floor. I think adding someone there, you're more likely to be conscientious of how you're speaking to these patients and the consequences that could happen if you are negative towards them. So just to discuss, this should provide an educational course on substance abuse patients. It should help with an increased understanding and empathy towards this population. This can be implemented in hospitals, mental health facilities, especially detox units and emergency departments. And the educational course should absolutely be implemented in undergraduate nursing courses. We briefly discuss it, but I think it should be more in depth because I've already experienced working with these patients, so I know I'm going to more and more throughout my career. And it's important to have a good nurse-patient relationship, substance abuse or not. And I also wanted to add just a little review of my poster board.